Namaste. Welcome to the third episode of Health Matters by Thought Habitat Speaks. The COVID 19 virus is causing a lot more chaos than last year. While last year we were counting everything in tens and hundreds, now we are counting in millions and billions. While across the globe, all other countries are facing a third and a fourth wave, India has entered the second wave, and we can visibly see how much chaos it is causing to our lives. Our near and dear ones are affected. Our near and dear ones have tested positive, and most of them are hospitalized. Most of them are suffering. Even though we have a vaccine in place, it is going to take some time, I believe, and there is a lot more. And added to all that, we have some important celebrities who passed away, and the kind of rumors and fake news that is going on in the mainstream media is causing a lot of fear among the public. So I won't say we are going to create awareness among all of them. Given the reach of our channel and reach of YouTube and the reach of the internet media, we would say that at least a few little folks out there would understand, would be aware of the scenario, and they won't fear and they would spread out the word to others. So, to do that, we have a special guest today. He is Mr. B G Venkatachalam. Just a few words about him. He is someone who comes with 3 decades of experience in the pharmaceutical industry. And he didn't stop there. He went ahead and he thought healthcare education has to reach to the grassroots levels. And he started the Health Planters magazine with a vision to inculcate basic healthcare education among school children, and through the school children to their families and to the entire society. And he didn't stop there just with the magazine. He went on to perform a campaign called Seed, which educated the school children on specific health issues, be it something related to heart, be it something related to gastrointestinal, or something related to brain. So everything was covered under Seed. And then he was the one who conceptualized what I'm talking is in the early 2010 to 2015. He was the one who conceptualized e-commerce site, a first of its kind e-commerce healthcare portal, touchpill.com, where the medicines were made available online for folks across the country. And now he is associated with TTK Group, and he is continuing his decades of experience in the pharmaceutical industry. So, without much delay, sir, thank you so much for joining with us. I must call you as a frontline worker now. Being a frontline worker, you people are busy getting vaccines, test kits, and everything, and still you made some time for us, and you're here to create awareness among the public. Thanks a lot for all that.
Yeah, Aravind, it's a pleasure being with you here. Thank you for inviting me and giving this opportunity. It's a good platform to meet many people and educate on vaccine today. I really delighted to be a part of your mission. Thank you for the invite.
Thank you so much, sir. So, sir, I'm jumping on to my questions. So, even though vaccines are in place, and we've seen that most of the people above the age of 45 are already vaccinated, still it is pretty evident that not everyone is going to get vaccinated immediately to stay away from the fear of virus spread, right? So, in your opinion, how long is it going to take for everyone, for the entire population to get vaccinated?
Yeah, it's a good question actually. A very timely one. Today, we have around 4 to 5 candidates of vaccines across the globe, and a lot of queues we can see in every hospital for vaccines, and some states are drained out of vaccines. If you ask me today, with Indian population of 130 crores, the statistics says around 8.5 crore population already got vaccinated. Okay, if you go with the same statistical model, maybe it will take another 6 months, 7 months, 8 months. We can extrapolate and say, but that is not the story all about. Coming to vaccine, it is again the same model like the we say that the first movers, we are the early adopters, innovators. These people who will come forward and get vaccinated first. The second grade of people, seeing others getting impacted, they come for the vaccination. So here not the question of making the vaccine available, the question of creating awareness and creating the importance of vaccine to get into the body is important. So what we see in the first euphoric moment now, there are around 800, 8.5 crores of population getting vaccinated, is not going to the same way it's going to be. Maybe next spurt will be there. After that, it is going to be we have to push people to get vaccinated. Okay, we should go by that. I don't expect entire Indian population to be vaccinated so that we kill the virus spread. Need not be. Even you achieve sizable 50 to 60% of the population getting vaccinated, definitely we are winning the war. We'll put a stall for the rapid growth of coronavirus. That's what we should aim at this point of time. To get this, how much time will take? I can say the way we are going and the way we are getting into the market by July and August. I think we should hit the number of 50 to 60%. If you ask me, the only way vaccination you achieve this number, I'm afraid I don't think it's possible. You will have two kind of protection. There are some people get vaccinated and protected, some get infected and get protected. Ultimately, the goal will be achieved. We will have a kind of good kind of immunity towards this coronavirus, and we can come out of the coronavirus fear. So you target around July or August. I think we are almost there. Yeah.
That's really interesting to know. And sir, the next question is, even after getting vaccinated, some people are contracting the virus. You know, one best example I would say Akhilesh Yadav, former Chief Minister of Uttar Pradesh. He is someone who he is someone who got vaccinated and he contracted the virus. So how does that work? Does it mean that the virus is getting immune to the vaccine?
Yeah, yeah. See, this actually always happens. So even in all the studies, if you see how the studies are being conducted, they are doing a large trials with thousands of people getting tested, and for example, 15,000 people are tested giving a coronavirus vaccine, and after second dose, then they expose them to the coronavirus again. So you get around 150 getting infected. So the hardly the percentage of people getting infected with a hardcore real species exposure, which amounts to 10 to 15%. That means the large population, sizable population, 80 to 85%, sometimes 90% of population are having a very good response to take this vaccine and develop their own immune system, create a kind of good immune response and produce antibodies, which is sufficient enough to protect their own body. There's 15 to 20% or maybe 10 to 15% of population who is not getting the immunity. That is not a factor which determines the vaccination schedule or vaccination program. Okay. When we say some people are got vaccine and they got again the virus is very common. The one such wrong examples can spread like a wildfire. People start following it. My debate here is that is not the real deterrent for vaccination program. People who believe in vaccination, who understand the science behind vaccination, they continue to go and get vaccinated. People who are not believing it, talking against this vaccination program, they'll pick up those examples and extrapolate. So it's only the belief system plays a role here actually. and again you further go dig into the entire thing and see and what when see the chances of one is the immunogenicity of individual not responding to the vaccine is one probability. Second, the storage of vaccine and vaccine quality what they got is second probability. Third is actually what kind of lifestyle, how much of exposure he got, again a kind of a probability. So many probabilities. With that you get around 10 to 15% of people, despite getting vaccinated, may get infected. So let's not talk about that. It is absolutely minuscule. Talking a larger vaccine program, and we have wonderful products in hand, which will definitely make our population get protected.
That's wonderful. And sir, so as we all are aware, a very famous actor, Mr. Vivek, who has done like hundreds of movies, and he is someone who really uh, came forward to support any kind of healthcare campaigns taken forward by the government. Even like recently, last week, if we see, he came forward and he got vaccinated, and he was like urging people to come and get vaccinated for their safety. But unlikely, the next day he developed a heart attack, and unfortunately, we had to see his demise. But going forward, we did see that many people are saying that only after getting vaccinated he got this heart attack. So that is why. And also, one other actor, he went on a rampage, saying accusing the government, accusing the healthcare system, accusing the pharma companies, accusing everyone, saying that don't get vaccinated, don't wear masks. While some of us really believe it is all fake, a large number of people are falling to that. They're falling toward that, okay, maybe he's right. That is why the government is doing all this. I see that that is completely wrong. So, what is your opinion on that, sir?
Yeah. It's again a very timely question, Arvind. See, Vivek is a wonderful, versatile actor, and whole population loves him for his humor and also the forward thinking. He want to eradicate. See, for what he was fighting in his movies, remove the superstitions, unwanted belief. Okay, now people are trying to put some belief on him. He died of vaccination. See that paradox. He the one want to remove all those this kind of wrong links and superstitious thoughts. Now he is getting linked to that. If you go by the doctor's version, and none of the what do you call report says that there's any link between his death and vaccination. It's a purely myocardial infarction, a very large artery getting blocked almost 100%. It's sudden burst. Here, actually, two things we can talk about. Even after this incident, even we say that people are talking about this, but I don't see the queues in the hospital to get vaccinated is getting reduced. Again, goes to my own point saying that the people want to get vaccinated, understand science, they absolutely go for it. And again, people like to blow up the points which is not actually relevant, create a confusion in the market. They definitely pick up these kind of points and try to blow up in the system. But to here, I like to tell the viewers there is no link between his death and coronavirus vaccination program. So let's follow Vivek what he was talking about. He is such a person who noble person trying to fight out to remove all unwanted paradox and linking and superstitions. And we will not link these two and demean his popularity in this. That's what my appeal on this actually. There is no
That's
link.
that's really well said, sir. He was the one who was fighting to eradicate superstitions, and he was the one who was fighting for all these. Even his campaign on dengue was
Yeah,
pretty good. And unfortunately, I believe his son got affected because
of
during that time, and when it came here, and he got affected. You
see,
know,
if at all, Aravind, you want to take up a point from Vivek's death, the point to be driven is the different topic altogether. How to identify cardiovascular problems at early stage. The people health awareness, master health checkups, what they should do when they cross the age of 45 years and they have to go for the entire health checkup, check their heart, health of the heart, and diabetes and periodical checkup. Everything is important, and following the medication therapy is important. I'm not sure whether Vivek had this problem. He has already a predisposition or he was in the medication. But in general, this kind of sudden heart attack and death creates a kind of awareness to people that they should be cautious about their own health and check their heart health. It's very important.
Yes, sir. Yes, that is really quite a good advice, and people should really follow that seriously. Yeah. So, sir, the next thing is like we are saying that a mutated virus is making rounds, and that mutated virus is causing a lot of youngsters than the old population, and that is the reason why we are seeing a lot of cases out there, right? So, will this vaccine have the potency to fight the mutated virus as well?
Yeah, the beauty of evolution, either it is a virus or a human, we all evolve. And when we evolve, why can't virus? Virus also a life given by God has given a life, and it has to evolve and has to get mutated. It finds its own way to get into and change its own structure and impact more, give more kind of harm to the people. Okay. As per the what data we see and the past records of different vaccinations and virus vaccination programs, mostly these antiviral vaccines are effective against mutated species also. Though we can't authentically say that this vaccination is going to be one solution for all kind of future variants going to come, we can't say, but we can have a kind of feel that earlier the flu vaccines or hepatitis vaccines, whatever we had, all these vaccines are by and large able to cover a kind of some extent of the mutated viruses. Then the new species comes become more hazardous. Definitely we have to evolve and produce much different kind of virus vaccines. But at this point of time, it covers. To just take an example here, like last year, at the same time, if you compare 2020, when coronavirus is actually growing globally every place, many doctors and paramedical staff, they're all dying of coronavirus. In fact, we lost many of very renowned doctors and paramedics for COVID. But after the vaccination program, today, if you see, the same kind of doctors are working across the globe, and I am not hearing much of doctors and paramedics getting impacted by coronavirus. So, by and large, this mutated virus, which is floating in the market, in the society or community, which is not actually impacting the people already got vaccinated. Here and there, one or two cases, we see that even after vaccination, they are getting. That's all, as I told you, it's only the probability of 10% ratio or the individual immunogenicity. But in general, I see this mutated virus, what is prevailing in the market at this point of time, is being covered by the available vaccines on date. This is good news. So we can definitely go for the JAGs and take that and protect ourselves from whatever the species we talk about. We are protected now. That's the
That's
news.
really quite affirming to hear from you because, as the evolution continues, as the evolution of the virus continues, we keep thinking at each level that, okay, what if it is going to cause more trouble? Like, what is going to happen next? Okay, this vaccine was made last year. How is this going to help me now? And, all those questions arise, and, your answer is really quite affirming for that. And, sir, one last question. So now that the vaccine is there and almost like 8 crore people have been vaccinated across India, and you did mention that July, September, that it would go. Like by July, September, a major population would get vaccinated if we go on the same level, right? So it doesn't really mean that once we all are vaccinated, we are safe from the virus, but the virus is going to exist, right? So, in your opinion, how long is that going to exist in exist in our, I mean, in the entire world?
Yeah, it's a very brilliant question. How long this ordeal going to stay? Can I have a day the corona-free world? I can't say that it's going to be a corona-free world. If I say that after 1 year, 2 years, it's going to be corona-free, I'm exaggerating. I'm lying actually. So this coronavirus will exist. So something which has come on Earth, which has a kind of growing and reproducing capacity, keep on growing like that, which has to exist on Earth. What I see is here, this coronavirus has come to Earth to get into the human body. Okay, it is up to us whether you want to take the virulent species into your body or attenuated or non-virulent species onto you, the form of vaccine. You decide. There are people still say, I was traveling in a Ola taxi. The taxi driver was telling, sir, past 1 year I am driving. I am not vaccinated, but I am not getting coronavirus. I don't believe in this virus. Why should I take? I'm surprised. This guy is the most vulnerable guy, and this guy has a potential to infect many people, and he's carrying many corona patients, picking and dropping. So, how to educate them? That's the main question. You know, this guy, either you should get a live species with the virulence, or you should get an attenuated species to protect himself. But corona getting into our body is 100% sure. It will stay with you, with me. We all will have a corona in the body. So only we should decide what we want to take. Okay. And my appeal here is like spread this message of vaccination program which works, and people, everyone should take vaccination to protect themselves. First. Second is, unfortunately, maybe I always use the word unfortunately, is when I see when the vaccination program started, there seems like 40 years person or 35 years person taking his father 80, 85 years old for a vaccination program. So the thing what you see here glaringly is a very active a person who is actually primary breadwinner of the family, maybe economic booster of the country, and you have a very pivotal role in playing the country's economy. We are not vaccinating him, and we are vaccinating a person who doesn't travel, who going to stay at home, who can very well avoid kind of contamination and contraction. He can stay at home, but this is actually scenario. It should be other way. A person, active person from 20 to 60 years, people who was already on a job and going around, and the chances of being a super spreader, and who is a breadwinner for the family, and also a person who really boosts Indian economy. These people to be covered in the first phase. If we could have done this when vaccine came into the market, we could have really stopped this kind of spread in the market, because they are the super spreaders. And if they are affected, the country economy and also the family economy gets impacted. We slipped down in that. Nevertheless, now the government has made a very widespread arrangement for more manufacturing for coronavirus vaccines, and you will see from 1st of May they opened up for 18 years and above can get vaccinated. Now at least we realize this. Make our friends and relatives whoever is not getting vaccinated, push them for vaccination. Give them option. Do you want a live species which is going to hurt you, or a dead species which is going to save you? You take whatever you want. These options should be given to them. Let them decide what they want. But ultimately, this program is going to help and many people to get vaccinated. And by September, I keep September 2021, I think we should be more or less out of the hazards of coronavirus. Though coronavirus stays, we don't get the effect of coronavirus either physically or by economically in the society. We will get protected. That's what I see a target of September 2021. I think the ordeal will come to a near normal end.
So September 2021 is going to be the
You can
life-changing
target.
period of
Yeah,
all
yeah.
our lives. Uh, and sir, thank you so much again. Like being a healthcare professional, you're the frontliner. You are leading all of us in this fight against the virus, and we believe. And you've given us affirming statements that we are in track, everything is in control. So that is kind of giving a lot of hope to me, and I hope that gives a lot of hope to others as well. And it was more of an awareness session that I'm sure many people are going to watch it, and many people will get aware of the scenario, and they will do a lot of word of mouth publicity for us, and eventually they will also get vaccinated. Thank you so much for joining with us, sir, and all the best. We are looking forward for more from you.
Thank you so much, Arvind. It's a pleasure. I'm delighted. Thank you so much.
Thank you,
Yeah.
sir.